Hey guys, welcome to the first edition of Dr. Shoukas Answers. This month's topic is breast implants. We're going to be fielding questions today, the most common questions that I get from patients. Our first question is, are drainage tubes necessary when breast implants are put in? And are they painful to remove? The answer is, I personally do not use drainage tubes when putting in breast implants. Some surgeons do. I typically use drainage tubes for other procedures like breast reductions and sometimes mastopexies and even breast reconstruction, but almost never ever do I use them with breast implants. If you do need drainage tubes, no, they are not painful to remove. It is as simple as just cutting the stitch that holds them in and removing them in the office. Hope that answers your question. Question number 2 is the life expectancy of implants. When, if at all, should you get them replaced? Well, that's kind of a loaded question. Depending on the type of implants and when you had them put in really determines whether or not they should be removed. Older implants greater than 10 years used to be thought to have a lower longevity, although that's not really true anymore with the newer implants. So that's really a personal decision that should be discussed with your plastic surgeon. What I tell my patients is I just need to know the type of implants you had put in, when you had them put in, and where exactly they are in your body, i.e. what pocket they're in. That really determines whether or not your implants should be removed or replaced, not an absolute timeline. Question number 3. After surgery, is the bra size equal to the augmentation size? This is a great question and we get all the time. The answer is no, it's not. Bra size in America is not a standardized thing. So for women who go shopping at different stores, you'll see that you're a different bra size depending on where you shop. If you go to Dillard's or you go to Macy's or you go to Victoria's Secrets, you may end up being a different bra size because it is not standardized like shoe size is. So augmentation size is based on actual precise measurements of a patient's breast. When you go in for a consultation, your breast will be measured just like you would measure your foot for a shoe, and that's how we come up with the correct augmentation size or the size of the implant. It is not based on A, B, C, D. That's a great question. Our last question is, are the latest silicone gel implants an improvement over the implants from 10 years ago? And the answer is absolutely yes. Silicone gel is commonly thought to be some sort of jelly or syrupy type substance. It's not. It is actually a solid device. The newest silicone gel, which you may have heard referred to as gummy bear implants, are now what they call highly cohesive, meaning that the solid structure of the silicone is more cohesive or sticks together better. So yes, the implants of today are much better than they were 10 years ago, and it actually means that they have a longer longevity and a lower complication rate. Well, thank you everybody for joining us for our first episode of Dr. Shoukas Answers. Please stay tuned for future episodes where we'll be fielding questions from you, the viewer. Thanks again. Have a great day.